Hi, I'm Christina. I'm gonna be your nurse today. We're just gonna go over some questions with you.
Okay, sounds good.
Okay. Can you start by telling me your name and date of birth?
My name is Sydney Goller, date of birth December 5th, 1999.
Okay. And then what is the reason for your visit today?
I'm just here for a wellness exam.
Okay, perfect. So I'm just gonna go through a bunch of questions, so just bear with me. We'll start with allergies. Do you have any allergies?
I just have seasonal allergies like to pollen, no meds, no food, nothing like that.
Okay. And do you take anything for the seasonal allergies?
Sometimes I'll use Flonase if I'm feeling it.
Okay. And is that something that your doctor usually prescribes, or do you just buy it over the counter?
I just buy it over the counter.
Okay. Are you on any current medications?
I take Lamictal 175 milligrams twice daily, and I'm on progestin-only birth control that I take once a day, and I take magnesium 500 milligrams once a day.
Okay. And then what is it that you take the magnesium for?
That's just for having low magnesium.
Okay. And then your Lamictal, what are you on that for?
That's for epilepsy.
Okay. So since we're on that topic, when were you diagnosed with epilepsy?
When I was 17.
Okay. And do you know what kind of epilepsy?
Yeah, I have juvenile myoclonic epilepsy.
Okay. And then, do you remember like what happened, like how you found out about
So when I was 17, I had my first seizure. It was a tonic-clonic seizure. And so I got taken to the ER, and they did a workup which was inconclusive, and so they admitted me and did like a 24-hour monitoring EEG, and with that they diagnosed me with myoclonic epilepsy. So I have lots. I used to have, before I was on meds, have lots of like myoclonic jerks where I would drop what was in my hand or my leg would twitch like that. But I didn't really know that was a problem until I had a tonic-clonic seizure, and then they told me that all those jerks were also seizure activity.
Okay. And since you started taking the Lamictal, things have been okay?
Yeah, it's been totally fine. At first I was on Keppra, and I got really bad side effects from that, so I didn't take it and then had another seizure. And then they put me on Lamictal, and it's worked great, no bad side effects.
Okay. And then do you follow up with anyone? Like, do you see someone yearly for that?
Yeah, I see a neurologist every year. They've done a couple of follow-up EEGs as well, and have said that no changes. There's still epileptic activity, but no like actual seizures happening. So I just see them pretty much once a year to get my prescription refilled.
Okay. And then do you know when your last EEG was?
It was probably about 2 years ago. I would say most like fall of 2023. It was when I moved back here. So probably, let's say October of 2023.
Okay. And then are you due to get another one anytime soon?
No, not an EEG. Mine was pretty much to like establish care at this when I found a new provider. They just wanted a EEG of their own to get a baseline. But while I'm still seeing them, they haven't told me a plan of getting another one.
Okay, great. And then any other past medical history?
I had a brachial cleft cyst on my right side that I got removed in August of 2024 that I had like my whole life, and then just got the surgery for it. And I also had asthma when I was a kid, but I grew out of it.
Okay. And then that cyst, have you had any complications since getting that removed?
No.
Okay. And then you said asthma, but you grew out of it, correct? Okay. Perfect. And then how is your mental health? Do you have any anxiety, depression, anything like that?
I definitely have anxiety, and I have like intermittent depression, not really right now, but throughout my life I've had some depression.
And is there any medications that you've taken or anything that you've done that has helped?
I've never taken any meds. I've gone to therapy, which has helped a lot with both. I feel like when I get more exercise and see my friends, that helps a little bit too.
Okay. And then are you currently in therapy for anxiety or depression?
Yeah, I currently see a therapist.
Okay. And then what is your home life like? Do you live at in a house, in an apartment? Do you have anyone living with you?
Yeah, I live in a house. We've been there for almost a year now. I live with my husband, and we have 2 cats.
Okay. Do you feel safe in your home?
I do feel safe.
Okay. Perfect. What are your cats' names?
Fergus and Momo. Momo is a kitten.
So cute. So now I'm just gonna ask you about family history, mom, dad, and grandparents. If you want to just start with mom and dad, and then we'll go from there. So just tell me about mom's family or mom's medical history, if you can.
Mom's medical history is bipolar disorder. Other than that, she has high blood pressure, I think, but nothing too significant.
Okay. And then what about her mom and dad?
Her mom also has high blood pressure, and my mom's dad died of a heart attack when he was 65, kind of like out of the blue. Like he thought it was all good, and then just random heart attack.
Oh wow, I'm so sorry. And then what about your dad's medical history?
My dad had polycystic kidney and liver disease. He passed away when he was 57, so in 2018. And he had a kidney transplant in the year 2000. And then when he passed, he was on the liver transplant waiting list. And he had like a ton of surgeries to get cysts drained and stuff like that. And he had lots of like complications from that, like high blood pressure, neuropathy, like just stuff that came from like kidney and liver problems that came from like the polycystic kidney and liver disease.
Okay, and what about his parents?
His dad died of cancer. I don't know which kind. But that was like long before I was born. I don't know how old he was, but long before I was born. And his mom had dementia, and that's all I know of as far as that side.
Okay, that's a lot of information, thank you. And then now we're just moving on to present day, what we got going on. So as far as like lifestyle, do you exercise regularly?
I do. I go to the gym. I play volleyball. So usually like 3 to 4 days a week I'm getting exercise.
Okay. Do you smoke cigarettes or use any recreational drugs?
No.
Have you in the past?
In the past I've smoked weed, but it's been probably like 4 or 5 years since I've done that.
Okay. And what about cigarettes? Any history of smoking
Never
cigarettes?
cigarettes.
And then what about alcohol? Do you drink at all?
I drink sometimes, maybe like a couple glasses of wine every couple weeks.
Okay, so mostly just like social?
Mm-hmm.
Okay. And then what is your diet like? Do you feel like you have a healthy diet?
Could be better, could be worse. I feel like we cook at home a decent amount. We usually make pretty healthy food, rice bowls at home. And when I eat out, it's usually nothing too greasy, fat food, nothing like that.
Okay, great. And then have you had any history with like high cholesterol or anything like that?
No.
Okay. So now we're just gonna go down, we'll do kind of like a full head to toe, talk about all that. So neuro-wise, do you have any numbness or tingling anywhere throughout your body?
Nope.
In your arms, hands, feet, legs, nothing?
Nope.
Okay. And then do you have any headaches, dizziness, anything like that on the regular basis?
I get headaches pretty often. If I work night shift, and so if I don't get a lot of sleep, a lot of times I'll wake up with a headache.
Okay, and does anything that you do help the headache, or do you take anything?
Well, if I get enough sleep, that helps, and if not, then ibuprofen usually helps.
Okay, and then do you wear glasses?
No.
Okay, do you see an eye doctor regularly or get eye exams?
No.
Do you know when your last eye exam was?
I think it was in 2021.
Okay. And we had no issues there?
No.
Okay. And then, what about any hearing issues? Do you wear hearing aids or have trouble hearing at anything? Okay. And then any issues with a runny nose, constant running, or like the postnasal drip?
No, I don't have a runny nose really unless I'm having like seasonal allergies, but I do have trouble breathing through my nose. I have a deviated septum, so I have a lot of trouble getting air in my nose.
Okay. So maybe we'll circle back to that and maybe we can do a sleep study.
Ooh, that might be good.
And then moving on, your blood pressure, have you had any issues with high or low blood pressure?
No, it's always been right where it should be.
Okay. Any chest pain or heart palpitations?
I do have heart palpitations sometimes. They're usually when I'm stressed, so I think maybe anxiety related.
Okay, so maybe therapy.
Yeah.
Once you see them again,
Yeah.
that'll help. And then skin, any moles, rashes, or anything like that?
No,
And then how about your hair and nails?
all good.
Okay. Any varicose veins or bruising easily or any bleeding?
No,
Okay. And then your breast, do you do your own breast exams or do you, okay.
yeah,
You do any lumps or pains, changes in size,
no,
color, look,
no.
nothing like that, okay. And then any issues with constipation?
Yeah, I can get constipated. I would say a lot of times I'll only go like once a week.
Okay, is there anything that you do to help with constipation?
Not really.
Have you ever tried maybe Miralax?
No, I haven't tried that.
Okay, maybe that's something we can look into and see if that helps. Do you get any nausea or vomiting or bloating whenever you're constipated?
I do feel a little bloated usually.
Okay, but no nausea or vomiting?
No.
Okay. And then what about, do you get regular periods?
Yeah, my periods are regular.
Okay. Do you have like heavy periods, light, or they seem pretty regular?
They've been heavier since I got on this birth control. But
Okay.
so now I would say they're heavy.
Okay. And then
Doable.
do you see a gynecologist regularly?
I do, yeah.
Okay. Do you get regular pap smears?
Mm-hmm.
Okay. Any history with UTIs or any issues with UTIs lately?
I've gotten a couple UTIs, nothing recently, but there's been a couple times where I have had them.
Okay. And have you gone to your gynecologist for that?
One time I went to my primary care and she prescribed me antibiotics.
Okay. And then what about any issues with your muscles or redness with your joints? Any swelling like that?
No swelling. I do have some achy joints, like my knees are always hurting, but that's kind of been since I was a teenager. But no swelling, no redness.
Okay. And then whenever you do have like achy joints, is there anything that you do to help or any medicine you take?
Just ibuprofen sometimes.
Okay. Whenever you do take ibuprofen, do you know the dosage that you take?
I take them in 200 milligram pills. I'll usually take 3 or 4.
Okay. What about any blood disorders? Do you have anemia or have you ever had a blood transfusion?
No, I never had a blood transfusion. No
Okay.
anemia.
Okay. And then just the last couple questions. I know I had asked you about excessive, or not, nope, I didn't ask you about this. Any history of diabetes?
No.
What about excessive thirst or urination?
No.
No issues there. Have you ever had thyroid issues?
No.
Have you ever had like any blood tests to test your thyroid or?
Yeah, they've tested before because I get cold really easily. Like even when everyone else is hot, I'm cold, and I'm also always tired. But like I said, I work night shift, so probably mostly that. So they did test, and they found everything to be normal.
Okay, perfect. Do you have any questions or need anything from me at this time?
No, I think I'm good.
Okay, well then, I think that's it for our exam, and then the doctor will be in shortly.
Thank you.
You're welcome.